from the station that's on your side. This is Channel 7 News Daybreak.
Yeah.
7 Daybreak, today's Wellness Wednesday. Dr. John Allen Cockerell from Baptist Health Family Clinic in Sherwood joins us this morning to talk about something important today. We're talking about prostate cancer awareness. September is Prostate Cancer Awareness Month. And Dr. Cockerell, thanks for taking some time out of your day. It is an alarming number when I read that every 3 minutes, someone in the U.S. is diagnosed with prostate cancer. And this is something that I know early treatment and early catching is important in terms of preventing something like this from expanding into something that could be very harmful to an individual. And we all know this, men are pretty reluctant to go to their doctors and talk about this. So let's talk about it today and get some guys screened and tested. First of all, what are some of the risk factors or signs and symptoms? Let's start with that we could touch on today that people need to be aware of.
Sure. So very important, obviously, and not always the most fun to talk about, but definitely warranted to bring up, absolutely, and things to watch for. Don't let these things slide by. So, things like bleeding in the urine, decreased urination ability, increased hesitancy or urgency, right, to urinate. Those are maybe more of the more common signs that deal with the urinary-based issues, but we're also looking at back pain without known cause, unintentional weight loss, night sweats. Those are all, considerations for signs and symptoms. And then, too, in terms of risk factors, which is another thing to be aware of, where are you in that spectrum? If you're 50 plus, of African-American descent, then you are at an increased risk statistically, as well as if you've had a family history of prostate cancer. So genetics play a big factor in this as well.
All right. Now, what are some of the things people could do to reduce their risk?
Sure. So thankfully, there are some things that are practical to try to do. And a lot of this, sounds, sing-songy almost when you talk to your doctor, because it always comes down to diet and exercise. But that's true here, too. So trying to avoid, red meats and increase hydration, regular exercise, lots of fruits and vegetables in the diet. Those things have been shown to help reduce the risk at least somewhat, because, again, one of the associations with prostate cancer is obesity. So we're trying to fight that front as well. And those things are some practical things that can help.
And when should someone go and get screened?
Golden question. So this guideline is actually not for everyone across the board. The U.S. Preventative Service Task Force makes this clear. And in the past, this has been a standard, go to your doctor, get a PSA, get a prostate check. We do those two ways, by the way. One is the digital exam, which is the actual physical palpation or feeling of the prostate. The other is the PSA that I just mentioned. That's the lab test, right? We'll talk about that. But in terms of the recommendation, this is individualized. So there is no set recommendation for everyone has to be screened here. It depends on a multitude of factors. It depends on where you are in your family history and what symptoms you're experiencing. Definitely something to bring up, however, right? We start thinking about that more 55 plus, right? So the PSA, just so you know, too, is not a perfect test. Sometimes has false positives. And that's why we don't just across the board say everybody needs this at a certain time, as in the past. So if it is an issue, we need to bring it up. We need to talk about it. We're happy to do that. There are ways to help. But it's an individualized thing to discuss. And I would encourage everybody that has any concerns to bring it up to their doc.
Dr. Cockerell, thanks so much for taking time out of your morning to talk about this very important issue. And we're glad we could spread some awareness during the month of September, which is Prostate Cancer Awareness Month. If you would like to talk to your doctor about this or any other health condition that you may be having questions on, you can contact them at the information on your screen. Dr. Cockerell, we'll see you next time. Thank you again.